Welcome back, everyone. Dr. Lawrence Cook back with us today from Lima Memorial Health System. He's at the Ada Medical Center. We're talking a little bit about strep throat. We certainly think about it this time of year. First of all, if you could tell us what it is and maybe what to look for.
So strep throat is a bacterial infection. It's caused by group A strep. People understand strep throat as a sore throat problem. And of course, not every sore throat is strep throat, but it's the biggest concern that we have. So we're looking for that sore throat patient that may need treatment further if they have strep throat.
Does it affect all ages or maybe a specific set of ages more than others?
So really, strep throat is most commonly seen in ages about 5 to 15. Very rarely in the young infants do we see strep. And adults many times do not get it when they're taking care of their children at home. They'll say they have 2 children with strep throat. The adults usually avoid it.
I know it's cold or flu season. That began in the fall, and we think so much about that and getting those symptoms. How do we know, is there a way to tell from the symptoms specifically of strep throat that, okay, maybe I need to get this checked out? This might be a little different than a cold or flu.
Sure, yeah. They do have kind of a complex of symptoms, and one of the things that patients have a tendency to look for is headache, bellyache, and sore throat. People describe the sore throat as being like swallowing glass, very sharp and stabbing. They'll always look in their throat, of course, and in the back of the throat, they'll see bright red spots in the back and on the sides. Sometimes the glands on their neck are swollen. You know, when you compare them to colds and flu and things like that, a lot of the symptoms overlap, but usually you don't have a cough with strep throat, and patients get a sense of strep throat when they think they have it, or the children when it gets severe like that.
If a patient comes in and they're getting tested for it, walk us through that testing process if you could.
Testing is very easy, especially in this day and age with everybody getting COVID testing. They use the same type of applicator, except it goes in the back of the throat. It's actually on the sides of the throat. We try not to gag the patients. So it's very easy. It's very easy.
Yeah, let's say we get that diagnosis then of strep throat. Walk us through the treatments. What kind of help is available there?
So treatment's important here. And I just tell you, treatment's important because strep throat can go on to cause heart problems and kidney problems. That's really the reason we treat strep throat. So treatment is with antibiotics since it's a bacteria. And we have multiple antibiotics. I know a lot of patients have penicillin allergies, and there are options for those patients to be treated.
You guys have the 8 walk-in care locations. That seems ideal. If someone really thinks, okay, I'd like to get in there today and do that, is maybe that the place to start?
Absolutely. It's very easy to get into the system. You just make a simple phone call or just walk up to the clinics, and you can be seen that day at that time.
All right. Help is available. Dr. Cook, thank you so much. We appreciate it.
Absolutely.
You bet. Nice chatting with you. We'll be back right after this.